We trust our healthcare systems to heal us, right? But what if the very system designed to keep us healthy is in its own way contributing to a global health crisis? Today, we're going to dig into that paradox and ask a really big question. Can we build a system that heals people and the planet at the same time?
So let's just start with this question because it really gets to the heart of a massive and honestly often overlooked problem. Think about it. Every single syringe, every energy-guzzling hospital, every complex global supply chain for pharmaceuticals, it all has an environmental cost. So let's unpack what that cost really looks like.
All right, first up, a dose of reality. And let's be super clear here. We're not just talking about some abstract philosophical connection. The health of our planet is our health. Period.
This is the fundamental takeaway. The climate crisis is a health crisis. When you see news about floods, extreme heat waves, or wildfires, you're not just seeing an environmental story, you're seeing the beginning of a public health emergency. You simply can't separate the two.
So where does healthcare as an industry fit into this whole picture? Well, the answer is kind of startling. The global healthcare sector is responsible for about 4 to 5% of all greenhouse gas emissions worldwide. For an industry that's whole mission is to do good and to heal, that is a seriously damaging footprint.
Just let that sink in for a second. If you took all the hospitals, clinics, and pharma companies and made them their own country, they'd be the 5th biggest polluter on the planet. This one quote just perfectly frames the scale of the challenge we're facing. The very system we built to protect our health is, ironically, a major player in the climate crisis that threatens it.
Okay, so where are all these emissions actually coming from? Let's get into the specifics. It's time to dissect the anatomy of healthcare's environmental impact. So to really understand the impact, we have to break it down. Emissions are typically organized into what we call 3 scopes. Scope 1, that's the direct stuff. Think of the gases used in an operating room or the fuel burned by an ambulance. Scope 2 is basically the power bill. It's the emissions from the electricity and heat a hospital buys to keep the lights on. But the real giant here, the one that's both the biggest and the hardest to tackle, is Scope 3. And this image right here shows you why Scope 3 is the elephant in the room. I mean, just look at that huge orange section. Up to 75% of healthcare's entire carbon footprint comes from its supply chain. This is the hidden impact. It's built into everything from the production of medicine to the manufacturing of sterile gloves to the shipping of surgical masks around the world. This is the #1 carbon hotspot we need to solve.
And, of course, this impact isn't spread evenly across the globe. Not even close. This chart shows that a few key players are responsible for the lion's share. You can see that the United States, China, and the European Union alone account for more than half of the world's total healthcare emissions.
So with a problem this big, how do we pivot from just identifying it to actually finding solutions? Well, it really starts by expanding one of medicine's oldest and most important principles: first, do no harm. In the 21st century, that oath has to extend to the planet too. The World Health Organization gives us a really solid goal to shoot for. An environmentally sustainable health system isn't just about doing less bad stuff. It's about actively improving health and the environment for all of us, now and for generations to come.
And this framework gets us a practical way to get there, based on 4 really smart, interconnected principles. It all starts with prevention and encouraging patient self-care. Because, let's face it, the greenest medical treatment is the one you never need in the first place. Then, for the care that is necessary, it's about creating lean delivery systems to cut out waste. And finally, always choosing low-carbon alternatives for everything from how we built our hospitals to the procedures we use.
Now, having principles is absolutely essential, but to drive real, lasting change, you need a way to measure your progress. You need a map. And that's where a comprehensive framework for transformation comes into play.
And lucky for us, the Lancet Commission has provided that map. What you're looking at here is basically a blueprint for transformation. It's not just a set of lofty ideals, it's a diagnostic tool. It connects a health system's inputs, like its workforce and its resources, all the way through to its ultimate outputs, which are, critically, both patient health outcomes and environmental outcomes for the planet. The goal is to measure, to benchmark, and then to take very specific, targeted action. Let's look at the 2 key domains it uses.
Okay, so the first domain is what you could call the system's software. It's the people, the policies, and the programs. It forces us to ask some really critical questions. Are we actually training our workforce in sustainable practices? Do our government policies and funding models support green goals? And as you can see down at the bottom, the framework insists that all of this has to be done while maintaining or even improving the quality and safety of care.
Then we have the second domain, which is the hardware, the tangible, physical footprint of the system. This domain tracks the whole flow, from the resource inputs like energy and water, through the infrastructure and the actual process of delivering care, all the way to the environmental outputs, the emissions and waste. This is where we get the hard data to measure our real-world impact.
Which leaves us with this final, and I think, absolutely critical question. The entire mission of healthcare is to build a healthy future for all of us. But can it truly fulfill that mission if the planet itself is unhealthy? The path forward really demands that we recognize that human health and planetary health are, and always will be, one and the same.